I do think that something like health care is best done in a bipartisan way. It's likely that that's not going to be the avenue that's taken at first. Obviously, it wasn't in the very beginning. The president went through quite an experience. Back home, we would call it a goat roping and trying to work with just Republicans, and obviously there's a lot of ideological differences. Becky, I sat at a lunch. I was asked to come over to a luncheon with the president, a small one. Had Freedom Caucus members there, and I appreciate the views of both the president and the Freedom Caucus, but when it comes to affording people the real opportunity to have health care, there's really not much overlap there. So it seems that one side is going to have to really give for this to happen on the Republican side. So I do hope in the interim we can do some things like Lamar Alexander and I have proposed, where people who don't have the ability to buy health care on the exchange can use their subsidy to buy it off exchange, and that would begin to do away with some of the harmfulness that's accruing to Tennesseans and people all across our country that really don't have a choice.
I mean, that seems like such a straightforward, clear way of trying to patch things up and trying to make a real fix that would make things better for Americans who are trying to deal with some of these issues. But is it any sort of compromise is so toxic when it comes to health care that it's not going to make its way through the Senate, or much less likely the House?
Well, you know, in fairness, the Democrats, really are not open to looking at changes until we move past this reconciliation process. And so we're in this place where, again, it seems like administration after administration has led with this issue, which has been a problem for each of them. We probably started
this issue meaning health care, you mean?
Yeah, I mean, it's the wrong place to start.
Because
I think,
it's so complicated and you burn so many relationships.
That's right. There are so many things that we can agree together on. Infrastructure may be one. Tax reform may be one. So we kind of led with our chin. We've ended up where we are today, and I don't really know how to move beyond this at present. Again, every one of us, Becky, Andrew, Joe, Andy, myself, we all benefit from the standpoint that our employer buys our health insurance, and therefore we get a tax benefit. It's roughly about $5,000 for each individual. For those people who do not get their health insurance from their employer, they don't have that benefit. And so the thesis behind this is you extend them a refundable credit to give them a viable option to actually buy health care, and that seems to be where some of the hang-up has been with the Freedom Caucus. But if you look at this bill,
we've had Freedom Caucus members who have come on and said that this is the biggest bill of Republican welfare they've ever seen in their lives. How do you work with that? How do you do something with that?
Well, look, Republicans for 20 years have advocated trying to create some tax fairness around this issue. It's been a Republican threshold issue, and the fact that those people who don't have health insurance through their employer don't have this benefit, and you're trying to create a mechanism for them to actually be able to afford health insurance, and at the same time put in place those tools that will allow it to lessen in cost. I mean, the 10 essential health benefits really are driving up the cost, and if there's a way to move away from those and allow people to actually buy health insurance that benefits themselves and their families, that is helpful to everyone. So there are a couple of things that they're not that big, Becky. They're just not that big that we could do to really transform the system, and then to move to Medicaid and give governors the kind of flexibility that all of them would like to have to really implement in cost-effective ways. I mean, those three areas that we're talking about right now would be substantial reform, and it would move us in a place that I would think that both Republicans and Democrats over time could cherish, but we're just not there yet.
Senator.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.